Christopher, you're here today clearing out some of your mother's things from Chartwell residents at Rockcliffe Island Lodge here in Ottawa.
Correct, that's what I'm doing.
Tell us why.
My mother's been at the Rockcliffe for 3 years, and in April my mother had a health crisis, and which lasted about a month. She was in the hospital, and upon her release, the Rockcliffe began billing her for extra support services, which I was under the understanding were being provided by the Rockcliffe. After the rates were brought up by about 30%, we were reaching close to $10,000 a month for my mother being kept at the Rockcliffe, which led me to decide to move to Ottawa to provide care for my mother myself, as I had just recently retired. And in the midst of setting up home care services, I contacted Champlain Lynn to set up the services, whereupon I was informed that they had been in fact providing the very services already to my mother at the Rockcliffe, for which the Rockcliffe was billing me for. And it was only after speaking with Lynn and being advised that these services had already been ongoing that I contacted the Rockcliffe and asked them to justify the extra $2,500 they were billing us a month. And upon making my inquiry, I was then advised by the Director of Care that Champlain Lynn had in fact been supplying those extra support services since day one, over the span of 4 months, and that she had just learned this fact on August 25th. The services started on May 5th. That means my mother was visited over the span of 113 days, with a total of 226 visits, and the Director of Care and the General Manager are trying to make me believe that they did not know these visits were taking place by Champlain Lynn. And they were billing me for it, as if the Rockcliffe was providing those services. Already I'd had issues. I thought the billing was excessive because there was issues with staffing shortages. They tend to have a rotating door of employees here, and they keep claiming that it's a staffing shortage when in fact I'm in the employment business. I know for a fact that it's actually a pay shortage. And while they're cutting corners, not making beds, staff being like a rotating door, I'd also like to point out that Chartwell's stock over the last 6 months has gone up 25%.
So somebody's making a lot of money.
Somebody's making a lot of money, and a lot of seniors are having their services cut, and seniors are paying for services that are being provided by the government as well.